In Sheffield, the strain of the social care sector is all too apparent. This is one of many care homes counting the cost of staff shortages and soaring bills. Using agency staff is necessary, but expensive, as energy and food costs are rising along with interest rates. It's a time of apprehension about how round-the-clock care can be provided.
We've seen staff leave the system through the pandemic. We can't recruit like we used to be able to recruit. We're not competitive with the pay rates. They're doing a fantastic job within our care facilities, within the trust. But sadly, we're not competitive.
Fighting their corner is the Archbishop of Canterbury, with a New Year's Day message advocating for urgent action and greater funding.
Our care system is broken, but it doesn't have to be. We can rise to the challenge of fixing it. That means action from all of us, you, me, families, communities, government. Caring goes to the heart of what it means to be human. It is hard.
Justin Welby wants carers to be valued more and paid more. He's highlighted how less demanding jobs can be more lucrative, adding to the staffing shortfall. There were 1.79 million posts in adult social care in England last year, but only 1.62 million were filled, a decrease of 3% on the previous year, leaving 165,000 roles empty. And the number of vacancies is only growing year on year. Boris Johnson promised to fix the crisis in social care after entering Downing Street in 2019. But the implementation of reforms has been delayed by political and economic upheaval. Rishi Sunak's government committed an extra £7.5 billion in November's autumn budget for adult social care over the next 2 years. But the head of the National Care Association says that's not enough.
There's been so much underinvestment in social care, despite all the rhetoric about how much money has been released into social care. The reality is it doesn't get to the front line. So our providers don't see it, and we can't then use that to actually be paying people more.
Filling care jobs would ease some of the burden on hospitals, with the most recent data showing around 14,000 patients were ready to be discharged after treatment but couldn't due to the lack of social care provision available. The population is ageing and less healthy, adding to the burden on an NHS lacking resilience, underscoring why fixing social care provision is seen as a priority for 2023. With his latest political intervention, the Archbishop of Canterbury has made clear what's needed, finding more funding for those receiving and providing care. Rob Harris, Sky News.